Today, we're diving into a really important topic: pressure injuries. You've probably heard them called bed sores, but that name doesn't quite capture what's going on. These aren't just simple sores. They're a sign of tissue breaking down, sometimes deep beneath the skin. So, we're going to walk through exactly how clinicians grade them, from what looks like a minor red spot all the way to a very severe wound.
Okay, so here's our game plan. First, we'll nail down what exactly a pressure injury is. Then, we'll look at the mechanics. How can simple pressure do so much harm? After that, we get to the heart of it, the official staging system. And we'll wrap up by looking at those tricky cases that don't quite fit the mold. All right, let's start at square one. Before we can even think about staging, we all need to be on the same page about what a pressure injury actually is. So, this is the textbook definition. The key phrases here are localized damage and prolonged pressure. Basically, imagine a part of your body, especially a bony spot, like your heel or hip, is pressed against a surface for too long. That constant pressure squeezes the tissue, cuts off the circulation, and that's exactly where the problem begins. But how does that squeezing turn into an actual wound? Well, it sets off a pretty quick and devastating chain reaction just under the skin. It really boils down to this simple but brutal three-step process. First, that constant pressure clamps down on the tiny blood vessels. That brings us to step two, hypoxia. It's a technical term, but it just means the tissue is being starved of the oxygen that blood normally delivers. And if that pressure doesn't let up, you hit step three. The tissue starts to die. That's called necrosis, and that's the beginning of the actual injury. And that process is exactly why we have the staging system. Think of it as a universal language that lets healthcare professionals describe just how severe an injury is, which is absolutely critical for figuring out the right way to treat it. Now, before we get into the stages themselves, you have to know the three golden rules. Rule number one, you stage what you can see. The stage is always based on the deepest layer of tissue that's visible to the naked eye. Rule two, it's always best to have a second opinion. Getting two clinicians to agree on the stage prevents mistakes. And finally, rule three, timing is everything. You have to stage the wound the day it's found because it can change, and fast. Okay, let's start at the very beginning with stage one. This is the earliest warning sign we can see, and it's a huge signal that we need to intervene right now. The most important thing about stage one is that the skin is not broken yet. It's still intact. The big giveaway is a patch of red skin, or what's clinically called erythema. But it's not just any redness. It has a very specific quality. It's non-blanchable. So, what in the world does that mean? It all comes down to a really simple test. If you press on healthy, red skin, the blood pushes out for a second and it turns white or pale. That's called blanching, and it's a good sign. It means circulation is working. But with a stage one injury, you press on that red spot and it stays red. That tells you the tiny blood vessels underneath have been damaged. That's our first official sign of injury. And there are other clues too. The redness won't go away even after you've removed the pressure for half an hour. Now this next part is so important. It looks different on different skin tones. On lighter skin, it's red, but on darker skin, it might look more blue or purple. The area can also feel different, maybe a bit firmer or warmer than the skin around it. Okay, so if nothing is done at stage one, the damage continues and we move on to stage two. This is where the skin's protective barrier is officially broken. The key phrase here is partial thickness loss. What that means is the top layer of skin, the epidermis, is gone, and now the second layer, the dermis, is exposed. It might look like a shallow, pinkish-red open sore, or it could even look like a blister that's either intact or has popped. The big takeaway is that the damage is still relatively shallow.
From here, things get much more serious. At stage three, the damage is no longer superficial. The injury has now burrowed through all the layers of the skin and has reached the fatty tissue below.
So for stage three, the term you need to know is full thickness loss. The wound is now a deep crater, and for the first time, you can actually see the yellowish fatty tissue, also known as adipose tissue. You might also notice that the edges of the wound look like they're rolling under. But at this stage, you will not be able to see muscle, tendon, or bone. And that brings us to the most severe classification. Stage 4. This is where the tissue destruction is so extensive that it reaches the deepest structures in the body. A stage 4 is also a full-thickness injury, but the damage has gone well past the fat layer. At this point, you can actually see or even feel things like muscle, tendons, ligaments, and sometimes even bone. It's an incredible amount of tissue loss and carries a very, very high risk for a major infection.
So that's the classic 1 through 4 system. It's pretty straightforward, right? But what happens when a wound just doesn't follow the rules? There are a few complicated cases that need their own special labels.
Okay, picture this. A clinician sees a wound, and they know it's bad, but the bottom of it, the wound bed, is completely covered with dead tissue. So how can you possibly assign it a stage if you can't see how deep it goes?
Well, the simple answer is you can't. And that's why we have a classification called unstageable. This means the wound is covered by slough, which is that stringy yellowish gunk, or eschar, which is a hard, leathery black or brown covering. Because of that covering, we have no idea what's going on underneath. We know it has to be at least a stage 3, but until a surgeon cleans it out, we don't know if it's a stage 3 or a much deeper stage 4 hiding below.
All right, next up is probably the most deceptive and in some ways the most dangerous kind of pressure injury. It's called a deep tissue injury, or a DTPI. From the outside, it might just look like a really bad bruise, a dark purple or maroon area of skin. The skin might not even be broken. But here's the problem. What you're seeing is just the tip of a very, very large iceberg.
That iceberg analogy is perfect because the real damage has already happened, way down deep, close to the bone. What you're seeing is the result of that deep damage starting to show up on the surface. And these injuries are notorious for changing incredibly fast. One day it's just a dark spot, and seemingly overnight it can open up into a massive stage 3 or stage 4 wound.
And finally, just a couple of quick distinctions. Sometimes a pressure injury is caused by a piece of medical equipment, like an oxygen tube pressing on an ear. That injury is still staged using the 1 to 4 system, but we also note its cause. On the other hand, if an injury occurs on a mucous membrane, think the inside of your mouth, it cannot be staged. The tissue there is just too different from skin.
So there you have it. That's the complete system for understanding and classifying the severity of a pressure injury. And while knowing the stage is absolutely the first step to proper treatment, it really just leads us to the bigger, more important question. What can we do to make sure this never happens in the first place? Because prevention, well, that's the real goal.